Let me share some information with you if you are a man over 60 years of age and you think it is typical to get up 3 or 4 times a night merely to urinate. Not only is such belief incorrect, but it is also hazardous. It is not true that getting up repeatedly during the night to go to the bathroom, feeling a sense of urgency, or standing over the toilet with a thin trickle of urine are harmless inconveniences that come with becoming older. These warnings are unambiguous indicators that your prostate is slowly but surely getting bigger. If you ignore them, you could lose your comfort, your self-confidence, and possibly your health. My name is Dr. Moit Cara. With over 30 years of expertise treating prostate enlargement, erectile dysfunction, low testosterone, and the various illnesses that impact men as they age, I am a physician and men's health specialist. I have assisted thousands of men in their 60s, 70s, and even 80s who had once felt defeated to find comfort and regain their lives. I want you to be aware of the fact that you do not have to go through this alone, and even more importantly, that there is still hope for you. The majority of men are informed that their prostate enlarges as a natural consequence of advancing age. However, the following is what actually happened. Age is just one consideration among several. The actual issue is that there are far too many guys who disregard the early indicators and the messages that their bodies are desperately telling them until it is too late to do anything about it. The worst indicator of all, which is the one that is most frequently overlooked, is getting out of bed multiple times throughout the night in order to urinate. I will introduce you to the 10 most severe indicators that your prostate is growing in size and why you should take them seriously now. This is because recognizing these symptoms is the first step toward regaining your sleep, your strength, and your manhood. I would also like you to remain until the conclusion, because I will also discuss a straightforward nightly routine that my patients perform that just takes 15 seconds and helps them to relax their prostates, regain their energy, and finally get a full night's sleep again. Before we get started, I would like to encourage you to subscribe to our channel and turn on the notification bell if you haven't already done so. This way, you will never miss a single important prostate health advice that is specifically tailored to the needs of men over the age of 60. If you feel a connection with this message, please leave a response in the comments section below. If it does not, type the number 0 so that I can have a better understanding of how to assist you. We will now start with the first indication, which is also the most frequently encountered one. If you find yourself waking up 2, 3, or even 4 times in the night just to urinate, this is not a natural part of becoming older. The earliest and most obvious call for help from your prostate is this continual interruption. Okay, I am going to address each of your concerns one at a time. Awakening numerous times during the night, experiencing nocturia. Whenever I am seated across from men in their 60s, 70s, and older, I hear a certain narrative again and again. Every time I wake up, doctor, they inform me that it is either 1 o'clock, 3 o'clock, or 5 o'clock, and each time it is only a tiny trickle. There are others who think it is a bother and shrug it off. Other people rub their weary eyes and sigh in irritation, and numerous others privately acknowledge that it causes them to feel embarrassed, elderly, or even powerless. But allow me to be really explicit. It is not typical for older adults to experience disruptions in their sleep due to the need to urinate multiple times during the night. When your prostate starts to grow, this is one of the first and most significant indications that this process has commenced. This is what is actually going on. Your prostate, which is shaped like a little walnut and is located below your bladder, encircles your urethra. When it begins to enlarge, even just a small amount, it puts pressure on your bladder and alters the way it stores and eliminates pee. Your bladder gets tetchy and excitable at night, making it impossible for you to get any rest. It sends messages to your brain indicating that it is time to empty out, even in the event that it does not contain much. Because of this, you find yourself tripping to the bathroom on several occasions only to urinate a few drops. It is not due to the fact that you consume too much water. It is not related to the fact that you are just getting older. Your prostate is silently requesting attention, which is why that is the case. One patient in particular, Robert, who was 72 years old, told me that he had not gotten a full night's sleep in almost 10 years. I will never forget him. It was his belief that it was his fate to have to put up with those seemingly never-ending trips to the restroom, just like every older guy before him. However, once we treated his prostate health, he was able to sleep for 6 and sometimes even 7 hours straight in just a matter of weeks. With tears streaming down his face, he entered my office and exclaimed, "Doc, I feel as though I have gotten my life back on track." Being able to identify this warning sign before it deprives you of years of relaxation, vitality, and happiness, that is the power of recognition. Consider for a moment how sleep that is interrupted affects your body. It robs you of your energy, it impairs your memory, it weakens your immune system, and it even increases your chance of stroke and heart disease. And yet, a lot of guys disregard it, convincing themselves that it is simply a natural part of getting older. It is not, gentlemen. Your prostate sends out the earliest cries for help in the form of recurrent awakenings during the night, and ignoring these cries simply allows the problem to grow worse. If this sign seems familiar to you, there is a possibility that you are already feeling the symptoms of the next one. This is due to the fact that as your prostate enlarges, it does not only interfere with your sleep, it also begins to alter the very manner in which your pee flows, and this shift is something that you absolutely cannot afford to ignore. A t-test is a statistical test that is used to compare the means of two different groups. One of the most frequently voiced complaints that I hear from guys who are sitting in my office is that their urine stream is not as strong as it used to be. They bend forward, lower their voices, and with a combination of frustration and humiliation, they confide, "Doc, it feels like I've lost the power." Even after a very long time has passed, it is still only a small trickle. There are many who tell me that they find themselves standing over the toilet for several minutes at a time, exerting themselves by straining and pushing, waiting for the flow to start, only to see it trickle out faintly. Others acknowledge that it makes them feel uneasy in public facilities, since they are frightened that strangers will give them weird looks if they spend too much time there. It is not only uncomfortable, but it also gnaws away at a person's self-assurance, their perception of their ability to control the situation, and their self-image as a strong and competent individual. The truth is that one of the clearest indications that your prostate is pressing against the urethra and that the passageway through which pee should flow freely is being constricted is a stream of urine that is weak or slow. Your bladder was much more capable of emptying with force and confidence when you were younger. However, once that route was wide open, the swelling of the prostate causes it to become constricted in a manner similar to that of a kinked garden hose. All of a sudden, the straightforward process of peeing requires a great deal of patience and stamina to complete, which is a far cry from how it felt before the pressure mounted and the flow weakened. It is more than just a little inconvenience. That strain puts pressure on your kidneys, your bladder, and your emotional well-being. One man by the name of Harold, who was 68 years old at the time, informed me that in the past, he would never waste any time. He was always in a hurry and never stopped moving. However, his pee stream slowed down after that. He remarked, "Doc, I feel like my own body is holding me captive in my own restroom." He dreaded going because he became so frustrated while standing there that he dreaded going. After we finally took action to treat his prostate, we saw a significant improvement in his voice and energy levels. According to the things that he communicated, urinating was not the only thing that it involved. It was about regaining his sense of self and no longer being held back by something so fundamental. I would like you to consider what this entails, gentlemen. That feeble current is not an arbitrary side effect of getting older. It is a warning that indicates that your prostate is interfering with the most essential function of your body. If you do not pay attention to it, the issue will simply get worse, which will result in even more discomfort, greater disruptions, and a greater loss of dignity. However, a weak current is seldom the sole indication. When the flow of urine slows down, a second concerning symptom frequently arises not long after the first. This second symptom is one that causes men to feel a sense of dissatisfaction and discomfort that lingers, even after they have completed using the bathroom. We are going to that precise place, the next stop on our journey. 3. The dollar amounts that are rounded to the nearest $10,000 are as follows: $10,000, $20,000, $30,000, $40,000, $50,000, $60,000, $70,000, $80,000, $90,000, and $100,000. The feeling of not having completely emptied your bladder is one of the most aggravating situations that men express to me. They say that they feel as though there is still something left behind after they have finished up at the toilet and walked away. "Doc, I just went to the bathroom, yet it feels as though my bladder is never satiated." That persistent heaviness, that insistent compulsion, it trails behind them throughout the day and particularly into the night. Furthermore, it is more than simply a nuisance. It serves as a continual reminder that there is a malfunction occurring within. I have witnessed men pacing back and forth in their bedrooms, shaking their heads in bewilderment, and admitting that they sometimes return to the bathroom 2 or 3 times in a succession, only to squeeze out a few drips. That is not merely the process of becoming older. Your prostate is the organ that is disrupting one of your body's most fundamental rhythms. This is the reason that it occurs. When the prostate enlarges, it compresses the urethra in a manner similar to how a clamp would constrict a pipe. Regardless of how hard it tries to work, the bladder is unable to pump urine past the obstruction, and a little amount becomes trapped inside. After some time has passed, the pee that has been left behind causes discomfort and pressure, in addition to the continual feeling that you have the want to go again. It is similar to attempting to unclog a pipe in order to drain a sink. You believe that it is empty, but the water has a tendency to stay murkier for longer periods of time. This takes an emotional toll on you as well. If you leave it untreated for too long, it might increase your risk of infections, kidney strain, and bladder damage. I remember a gentleman by the name of Samuel, who was 70 years old at the time, and informed me that he felt as though he were a prisoner to his own bladder. He would exit the bathroom, take a seat to read the newspaper, and then, within a few minutes, feel the urge to urinate again. He acknowledged that it was crushing his spirit. He was reluctant to go on road trips because he did not think that his bladder would be willing to comply. He declined invites from friends to spend time with them because he was ashamed by how frequently he made excuses to leave. The release that was shown in his eyes when we first started treating his prostate was quite remarkable. "Doc, I finally feel like myself again," he added. That is the emotional weight that this symbol carries with it. It deprives you of your independence, your natural inclination to act without restraint, and your sense of tranquility. Gentlemen, if you have the persistent feeling that you are unable to entirely empty your bladder, do not disregard this symptom. It isn't just a little inconvenience. Your body is sending you a message that your prostate is putting out more pressure than you are aware of. If this pattern persists, the following issue is nearly unavoidable. Many men find it to be humiliating because it continues to follow them long after they have left the bathroom. That is the next thing we need to investigate. The 4 in this context is a reference to the 4th step in the process of building the 2018 Chevrolet Silverado: leakage or dribbling following urinating. According to what many men have told me, the most embarrassing aspect of their prostate problems is not the repeated trips to the bathroom or the weak stream of urine. It is the dribbling that occurs subsequently. They believe that they have finished their business after standing at the toilet, shaking off and zipping up. After a few minutes have passed, they become aware of the moisture in their underwear. Or even worse, they notice a small stain beginning to grow across their trousers. I have had males sit across from me with their voices hushed, revealing that they carry tissues in their pockets or wear darker clothing only to conceal it. Some even go so far as to shun social occasions because they are afraid that they would find themselves in an embarrassing scenario. This is an inconvenience that goes beyond the ordinary. It attacks a man's pride and sense of self-worth, causing him to have the impression that he no longer possesses complete control over his own body. What is the reason for this to occur? As the prostate gland expands, it narrows the urethra, which affects the bladder's capacity to forcefully expel pee. After you believe that you are finished, minute quantities become ensnared behind the inflamed gland and gradually exude themselves later on. Imagine that you have turned off a garden hose, but you are still witnessing drops of water seep through due to the fact that the nozzle is clogged. That is precisely what your body is going through at the moment. This constant dribbling is more than just exasperating after a long period of time. It can cause a guy to feel a permanent state of uncleanliness, raise his risk of infection, and irritate his skin. I remember a patient named Charles, who was 69 years old at the time. He told me that he had stopped going on walks with his wife because he was afraid that he would experience public incontinence. "Doc," he said, "it feels as though I no longer have control over my own body. I feel as though I am less of a man." His self-confidence returned almost immediately after we handled his prostate problems, and the dribbling came to an end. Later on, his wife expressed her gratitude to me by stating, "You didn't just help him get better, you gave me back my husband." This symbol contains a secret. That is the truth. It does not only impact the physical body, it impacts the spirit and the marriage as well. But it also impacts the heart. Gentlemen, do not ignore the symptoms if you find yourself struggling with dribbling or leakage. There is nothing to feel embarrassed about. Your body is the source of the alarm sound. The symptom that usually manifests after this one is just as disturbing, if not more so. Urination impulses that are strong and intense, that come on without any advance notice and cause you to hastily search for the closest bathroom. And it is the next obstacle we must overcome by facing it directly. Show that the following statement is true for any natural number n, 2n plus 2. 2 and 2 is divisible by 8. Urgency. One of the most upsetting situations I hear about from guys is the sudden and overwhelming need to urinate that seems to strike out of nowhere. They might be at the dinner table, driving to visit their grandchildren, or even standing in the queue at the grocery store when they are suddenly overcome by such a strong impulse that they start to panic. They make their way toward the closest bathroom as quickly as possible, hoping that they would be able to arrive before it is too late. These events have resulted in accidents for some men, and the embarrassment that follows is overwhelming. I have seen patients who have admitted to me that they have avoided going out in public for lengthy periods of time, not because they do not want to live their lives, but because they are not confident that their bladder will cooperate with them. No man should ever have to experience the feeling of being imprisoned within his own body. The reason that these desires are unable to control is because your enlarged prostate is applying pressure on your bladder. As the gland becomes increasingly swollen, the walls of the bladder get irritated, resulting in them being excessively sensitive and reactive. The muscles in the bladder contract rapidly and violently instead of holding the urine until it is completely full. This causes an urgent signal to be transmitted to your brain, even when there is only a tiny amount of urine present. It is almost as though your body is screaming, "Wolf!" all the time, insisting that you react without delay, regardless of whether or not it is genuinely required. This continuous cycle of false alarms exhausts not just your bladder, but also your spirit, leaving you in a condition of anxiousness and tension. Dennis, a 74-year-old patient of mine, once told me about the time one of these urges came over him when he was attending a school play for his granddaughter. Just in time to make it to the restroom, he informed me that he had missed seeing her on stage during her big moment. He remarked through his tears, "Doc, it's not just about my bladder. It is regarding what I am forfeiting as a result of it." His story is not out of the ordinary at all. These abrupt impulses strip men of their self-assurance, autonomy, and the basic pleasures that they derive from their daily lives. However, when they are treated, a lot of guys are able to get their lives back on track and experience not only relief, but also a restored sense of autonomy. Gentlemen, If you are having these sudden desires that you cannot control, do not disregard them. They serve as a warning that your prostate is inflamed and that your bladder is under stress. A second symptom, which is even more difficult to ignore, is typically what follows this irritation: pain or a burning sensation during urinating. These are indicators that inflammation has progressed further than most men are aware of. We are going to that precise place in the near future. 6. The United States of America is the country with the highest per capita rate of gun ownership. Pain or a burning sensation during urination. When a man recounts the agony that he has every time he goes to the bathroom, there is a distinct expression that comes across his face. Frustration, dread, and resignation are all components of this cocktail. Doc, a lot of men have told me that it feels like fire every time they urinate. It's as like my body is punishing me for performing something that ought to be simple and natural. There are many who attempt to endure it, persuading themselves that it will eventually go away, perhaps because they believe it is only a reaction to something they consumed. However, if that searing sensation persists day after day, it eventually becomes impossible to overlook. This is not just a minor inconvenience. Your body is signaling you with a red flag that your prostate is inflamed and that your urinary tract is under stress. Frequently, the burning or stinging feeling that occurs is the result of an enlarged prostate, irritating both the urethra and the bladder. As the prostate becomes enlarged, it changes the way that urine flows through the body, sometimes resulting in a stronger and more acidic urine. That urine, concentrated in addition to being constantly pressurized and inflamed, produces an ideal environment for pain and discomfort to flourish. In certain circumstances, males may even get infections when the bladder is unable to empty completely, and germs grow in the urine that remains after it has not been completely expelled. In each case, the outcome is identical. Going to the bathroom feels like an agony every time. It is something to be dreaded rather than a moment of respite. You begin to fear even the most fundamental physical functions, which erodes your mental well-being and diminishes your quality of life. I think of a man named Lawrence, who is 66 years old and came into my office almost in tears. He had been battling with painful urination for weeks, and he had been telling himself that it will get better on its own. He was very fatigued due to restless nights and overburdened with concern by the time he saw me. He said that the thought that it could be cancer worried him. We were able to determine that his pain was associated with significant inflammation of the prostate rather than malignancy after doing a thorough evaluation. As soon as we started to deal with the fundamental issue, his stress was almost immediately alleviated. Afterwards, he informed me, "Doc, until it was gone, I didn't have a clue as to how much fear I was carrying." The fact that his story is true is evidence that listening to your body early on can help you avoid not only pain, but also unneeded fear. Gentlemen, if urination generates discomfort or burning, do not ignore it as something insignificant. It is one of the most straightforward methods your body uses to communicate to you that your prostate is experiencing distress. And occasionally, when the inflammation is intense enough to generate a burning sensation, it results in another symptom that is even more concerning: seeing blood in places where it should not be present. That is the next indication that every man who is older than 60 years old needs to grasp. 7. The year 2007 saw the release of the album Graduation. When a guy notices the presence of blood in an unusual location, such as in his urine or semen, he is greatly disturbed. Patients of mine have sat across from me with quivering hands, recounting how they were shocked when they looked down into the toilet bowl and saw scarlet in their urine or saw streaks of blood in their semen. "Doc, I thought I was doing all right, I confess. But then I saw it, and I completely lost my ability to move. It's what they told me. I was at a loss as to what to make of the situation. That fear is valid and well-founded, as blood in the urine or semen is never considered to be a typical occurrence. It serves as a strong indication that something more serious is taking place within the prostate or urinary tract. The prostate gland may develop inflammation and enlargement, which can cause the small blood veins within the gland to rupture due to the strain. This may result in the mixing of a few drops of blood with the urine or semen. Sometimes it is subtle, manifesting as a mere pinkish hue, while other times it can be far more obvious. In any case, it indicates that your prostate is experiencing a tremendous amount of stress. Infections or stones in the urinary tract can also be factors in certain situations. And although not every incident indicates cancer, it is always serious enough to require prompt attention. The hazard does not lie solely in the bleeding itself. Rather, it lies in what the bleeding signifies. The nagging discomfort, the swelling, and the quiet devastation that is taking place below the surface. I will never forget a man named Edward, who was 71 years old at the time. He came to me after having ignored this condition for several months. Every time it made its appearance, his uneasiness increased. He eventually succumbed to his fear and confessed his feelings to his wife. He had hoped that it would just go away on its own, but it never did. He was more terrified of the unknown than of the actual condition by the time that he arrived at my office. After running certain tests, we determined that the bleeding was the result of a significantly enlarged prostate that was not malignant. After undergoing therapy, the bleeding subsided. Afterwards, Edward subsequently commented, "Doc, I didn't deal with the truth sooner, and as a result, I lost months of peace." His experience serves as an example that the avoidance of a problem only serves to increase the anxiety that it causes, whereas taking action gives clarity and healing. If you ever notice the presence of blood in your urine or semen, gentlemen, do not disregard it. Do not postpone dealing with it, and do not fool yourself into believing that it is not a significant issue. When your body sets off an alert, you have an obligation to pay attention to it. This is due to the fact that if left untreated, the same swelling and pressure that cause bleeding will also make the simple process of starting to urinate increasingly difficult. And that is the next indicator that every man should learn to notice before it takes even more control of his day-to-day existence. Compute the product of all of the prime numbers that are greater than 7 but less than 18. Difficulty getting the process of urination started. When you are standing at the toilet prepared to relieve yourself and nothing happens, you experience a specific frustration. Time in seconds goes by. You put up a great deal of effort, you wait, and yet the stream has no intention of starting. The phenomenon is described by some guys as if their bodies have forgotten how to work together. Other people have expressed to me that they feel a growing sense of anxiety as they wait longer. It's as though they are engaged in a fight with their own bladders. I have had patients confess that they avoid using public facilities because they find the delay humiliating when other people are waiting behind them. This initial delay in urination may appear to be insignificant, yet it is one of the most striking indicators that your prostate is having an impact on your life. The urethra, which is the small tube via which urine travels from the bladder to the outside of the body, is surrounded by the prostate. It is possible for the gland to behave as a sort of gatekeeper when it becomes swollen, partially obstructing the opening to the extent that it is challenging to get started. The bladder may be brimming with urine, and the need to urinate may be extremely powerful. But the resistance that results from the obstruction is something that you cannot just overcome through willpower alone. There are some men who strain and push, tensing their muscles in the hopes of compelling the flow. Straining, on the other hand, makes the pressure much worse, severely aggravating both the bladder and the prostate. Your body is communicating to you that the road is no longer clear through that hesitation and those long, silent moments that precede the start of the stream. I have a guy named Martin, who is 65 years old. He admitted to me that he would occasionally have to stand in the bathroom for 2 or 3 minutes before he would produce even a single drop of urine. "Doc," he added, "it makes me feel like I don't have any power over my own body anymore. It makes me feel helpless." One of the cruelest aspects of this sign is the feeling of powerlessness that accompanies it. Urination is not the only thing that matters. It also involves losing faith in your body and questioning when it will fail you once again. Martin related to me that the first time he was able to urinate without hesitation after we treated his prostate disease felt like a victory, as if he had reclaimed a bit of his manhood. Gentlemen, difficulty initiating urinating is not a trivial discomfort. It is your prostate that is obstructing you from carrying out the most fundamental activity of your everyday routine. If you choose to ignore it, you are simply giving that impediment permission to become even more substantial. Furthermore, after the flow of urine has finally started, many men learn another painful fact. The same obstruction of the prostate that is interfering at the beginning also has an effect on their sexual performance. That is the next sign that we must talk about with both honesty and boldness. A, the number 1,000,000 is equal to 10 to the sixth power. For many men, one of the most unpleasant repercussions of prostate difficulties isn't just the late-night toilet trips or the feeble stream, it's what occurs in the bedroom. Difficulties with erectile dysfunction and loss of sexual confidence are among the most distressing of the symptoms. I've had a plethora of men who have lowered their voices, looked down at the floor, and confessed, "Doc, I'm not able to perform the way I used to." Some report to me that they have difficulty achieving an erection at all, while others indicate that they are unable to sustain one long enough to feel emotionally connected to their spouse. It is not just the physical battle that weighs them down. It is the tremendous emotional toll that follows, the guilt, the self-doubt, and the dread that they are disappointing the one they love the most. There are few things that may wear down a man's self-confidence more quickly than these emotions. Many people are unaware of the fact that there is a closer connection between erectile dysfunction and an enlarged prostate than they assume. When the prostate enlarges, it disrupts blood flow, nerve signaling, and hormone balance, all of which must function in concert in order for an erection to take place. Add to that the persistent exhaustion that results from a lack of sleep and the stress that stems from concerns about urinary symptoms. And suddenly, intimacy is something that men steer clear of rather than relish. Frustration and quiet have taken the place of the feelings of happiness, intimacy, and pride that once existed. The reality is that a decrease in prostate health nearly always has a negative impact on sexual health as well. I can recall a man by the name of Anthony, who was 70 years old at the time. He confided in me that he had begun to make excuses to his wife whenever she reached out to him during the night. He remarked to me, "Doc, that I felt like I was less of a husband. I gave up trying because I was afraid of letting her down." His voice sounded incredibly sad at first, but once we addressed his prostate condition and worked on improving his circulation and self-confidence, his whole attitude improved. Weeks later, he returned into my office, standing straighter and smiling wider. "I feel like myself again," he remarked. "My wife says that she got her husband back." His tale is evidence that prostate problems have an impact on more than just the body. They affect the individual's marriage and spiritual well-being in addition to their feelings. Gentlemen, if you are experiencing difficulties with erectile dysfunction at the same time that you are having problems with your urinary tract, these problems are not occurring independently of each other. It is your body's method of letting you know that your prostate is the focal point of the situation. Despite the fact that this symptom can be heartbreaking to experience, it does not spell the end of the road. However, if it is ignored, the same inflammation and strain that can harm intimacy can also result in another never-ending burden. We must work together to discover the ultimate indication, which is a low, dull pain in the pelvis and lower back that follows you around like a quiet shadow. Which of the following is not a way to increase the resistance of a conductor? A. Increase the length. B. Decrease the cross-sectional area. C. Decrease the temperature. D. Use a material with a higher resistivity. C. Decrease the temperature. A persistent discomfort in the pelvis or lower back is one of the most commonly ignored but profoundly concerning symptoms of an enlarged prostate. A lot of guys brush it off as arthritis, muscle strain, or just the effects of getting older. However, If I start paying closer attention to their narratives, the similarities become quite obvious. They talk about a persistent feeling of heaviness in the lower belly, a pain in the hips or groin, or a continuous pressure in the back that never completely subsides. Some men have told me that it feels like they are dragging around a concealed weight all day long, something that saps their vitality and makes even the most basic chores feel more difficult. This type of soreness does not occur randomly. Your prostate is silently irritated, and it is emitting stress into the tissues that surround it. In close proximity to the muscles, nerves, and blood arteries that are located in that area, the prostate is situated deep within the pelvis. It not only applies pressure to the urethra and the bladder when it becomes larger. Additionally, it causes tension to be produced throughout the pelvic floor. That stress can cause pain that radiates to the lower back, hips, and thighs. For certain guys, the discomfort is slight but continuous, similar to background noise that they are unable to get away from. In other cases, it flares up during lengthy periods of sitting after engaging in physical activity, or late at night, when the body should be in a state of rest. In any case, the pain wears down the body and the mind, resulting in exhaustion and dissatisfaction. I think of a patient of mine, Gerald, who is 69 years old. He came to me after experiencing this type of pain for several months. "Doc," he said, "I thought that it was just the natural process of getting older, but the more that I ignored it, the worse it became. I felt like my body was betraying me, and I couldn't spend time with my granddaughters, and I couldn't sit through church." Following our treatment of his prostate disease, his discomfort subsided and his spirits improved. After many weeks, he returned into my office with a smile that I had never seen before. He commented that he felt lighter and freer, and that he finally felt as though he could breathe again. His experience serves as a reminder that pain in the prostate is not simply a medical issue. It robs people of their happiness, their ability to interact with others, and their quality of life. Gentlemen, do not disregard persistent soreness in the back or the pelvic region. It is an indication that is obvious and compelling. Your prostate is under stress. And now, for the truth. The indicators compose a story that your body is yearning for you to hear when we put them all together. Waking at night, feeble stream, urgency, pain, bleeding, erectile problems, and this constant agony. And that story brings us directly to the conclusion, where I will demonstrate how to take back control, protect your prostate, and restore the vigor and vitality that you deserve. You are not broken. You are being warned, to put it simply. We have gone over 10 of the most prevalent and concerning indicators that your prostate is getting larger and needs to be addressed, gentlemen. Being awakened several times during the night, experiencing difficulty with a weak or slow stream, having the sensation that your bladder is never really empty, coping with dribbling after the fact, or being confronted with sudden cravings that take you by surprise are all factors that take away from your comfort, rest, and self-confidence. The prostate has the ability to have a significant impact on every aspect of a man's life, as evidenced by the fact that it can cause pain or burning during urination, the shock of seeing blood in the urine or semen, difficulty in even starting to urinate, the heartbreak of erectile dysfunction, and the unrelenting ache in the pelvis or lower back. These inconveniences are not separate incidents. They are interconnected elements of a bigger picture, indications from your body that something is out of balance. For almost 30 years, I have been listening to men tell these memories, which are often muttered with embarrassment or hidden for years under quiet pain. I have witnessed the way in which these symptoms not only drain the body of its energy, but also serve to oppress the spirit. Men who formerly exuded self-confidence start to question their own abilities. The husbands who previously had the impression that they were close to their wives are now withdrawing into quiet. Grandfathers who have a strong desire to spend time with their family often find themselves too exhausted, too stressed out, or too preoccupied by the continual need to use the bathroom. And yet, I have also been a witness to the absolutely remarkable transformation that takes place when men eventually begin to treat these warnings with the seriousness that they deserve. Allow me to impart some critical information to you. There is nothing wrong with you. You do not lack strength. You are not merely suffering from the effects of aging due to your current situation. It is the method by which your body draws attention to itself and asks you to pay closer attention. Everything might start to alter as soon as you do that. I have witnessed guys who believed that they were past their prime recover strength, energy, and closeness that they thought they had permanently lost. I have witnessed the visible signs of relaxation in their eyes as they fall asleep and remain asleep for an entire night for the very first time in years. I have heard the happiness in their voices when they tell me that they can watch a movie without being interrupted, that they can enjoy a meal with their family, or that they can hold their spouse's hand without worry of being interrupted. All 10 of the symptoms that we have gone over, be they urgency, dribbling, a thin stream, or pain, are ways in which your prostate communicates with you. Together, they create a statement that is so significant that it cannot be overlooked. In the comments box below, let us know what you learned today and what change you intend to make. We all develop when we share. Let's assist each other. If you found this video to be even the slightest bit insightful or beneficial in any way, please remember to click the like button. Make sure that you do not miss out on any information that may have an impact on your health by clicking on the subscribe button. Before you go, make sure the bell is switched on. Input the number 1 if you found this video to be of assistance. If not, enter the number 0. It may not be apparent to you how significant your comment is. Your well-being counts, and you have the ability to make changes. You will be able to take action sooner, and you will be able to take back control of the life that you desire sooner if you begin listening sooner. With this, I leave you. Don't delay till circumstances become more dire. Do not wait until you are waking up 5 times during the night, until intimacy goes away, or until the discomfort reaches an excruciating level. You possess the ability to take action at this very moment. Begin with mindfulness. Talk to your physician. Implement gradual yet consistent modifications. Your prostate is tuned in, your body is on standby, and the future is still very much up to you. In the next stage, I will give you something that I know will be of great benefit to you. I will share with you a simple but powerful nightly ritual, just 15 seconds, that has helped numerous men quiet their prostates, sleep sweetly, and wake up feeling whole again. Remain by my side because this is the point at which optimism transforms into action.